He told me he hadn't cried since he was 9 years old. He said it like it was something to be proud of. And then I uncapped the syringe, and he went very, very quiet. It was a late Wednesday evening, the kind where the sky can't quite decide between purple and gray, and the whole city smells like rain that hasn't arrived yet. I was doing a favor for a friend of a friend. You know how that goes. Someone texts someone texts you, and suddenly you're standing in a stranger's apartment with your kit bag over your shoulder and a very tall man staring at you from across the kitchen, like you've just walked in carrying a medieval weapon. His name was Daniel. He introduced himself formally, which I found charming, like he thought a handshake might establish some kind of power dynamic before the needle entered the picture. He was maybe 32, 33, broad shoulders, the kind of jaw that looks like it was drawn by someone who was trying too hard. And he was terrified, not in a dramatic way, in that very specific, very masculine way where a person is clearly terrified but would rather dissolve into the floor than admit it. "So," he said, leaning against the counter, "you've done this before?" "Once or twice," I said. I was pulling on my gloves. That sound, the snap of latex, I've learned it does something to people. Some relax, some tense up like a guitar string being tuned too tight. Daniel was definitely the second kind. He'd been prescribed an intramuscular injection. His doctor had sent the prescription, the medication was already there, and his regular clinic was closed. He'd called 3 people before he called his friend, who called my friend, who called me. I didn't ask who the other 3 were. I had a feeling they'd all said no. "You can sit on the chair," I said, nodding toward the kitchen chair. "Or we can do this standing, whatever's more comfortable for you." He blinked. "There's a comfortable option?" I smiled. "There's a less uncomfortable one. That's about as good as it gets." He chose to stand, which is fine. Actually, for intramuscular injections, standing can work well if the patient is relaxed enough. The key word being relaxed. Daniel was approximately as relaxed as a man waiting for a verdict. I asked him to unzip his jacket and roll up his sleeve partway. Not for the injection, just so I could check something. Sometimes I like to see how a person's veins look, get a sense of their tissue, their general build. It tells me things. He had good circulation, warm skin, the kind of hands that probably do something physical. He'd mentioned he worked in construction, project management, something like that. Hands that knew how to grip things. But we weren't going into a vein today. This was intramuscular, into the muscle. And for that, the most reliable site for an adult is the ventrogluteal area, or, if that's not accessible, the vastus lateralis, the outer thigh. Both are safe, both are well away from major nerves and blood vessels when you know what you're doing. I explained this to him briefly, in plain language, not because he asked, but because I've found that when people understand what's happening to their body, they stop fighting it quite so hard. "The outer thigh," I said, "just above the knee, on the side. It's a large muscle, good blood supply, absorbs medication well." He looked at his thigh, then at me. "That's okay, that's fine." I told him to sit down after all. He sat. He put his hands on his knees and looked straight ahead at the refrigerator like it owed him something. I crouched beside him, not in front, not looming. And I spoke quietly, the way I always do when someone is afraid. "I'm going to clean the site first. You'll feel cold." The alcohol wipe is always a small mercy. It gives the skin a second to register sensation, gives the patient a moment to brace for something that turns out to be nothing. And in that contrast, the actual injection becomes smaller in their mind. I let the area dry. That matters more than people think. Injecting through wet alcohol can sting more and introduces unnecessary irritation. 30 seconds. I've learned to count them without rushing. The needle I was using was appropriate for intramuscular delivery, long enough to reach the muscle through the subcutaneous layer, fine enough not to cause unnecessary trauma. I aspirated briefly before injecting, just to confirm placement. Old habit. Good habit. If you ever see blood pull back into the syringe, you stop. You reposition. You never inject into a blood vessel when you're aiming for muscle. It doesn't happen often, but you always check. I told him to take a breath in. He did, and let it go slowly. He exhaled. His shoulders dropped maybe half an inch. That half inch is everything. I inserted the needle at a 90-degree angle, smooth, deliberate, no hesitation. Hesitation is what causes pain. A confident, steady entry through relaxed tissue is almost nothing. He made a small sound, more surprise than discomfort. "That's it?" he said. "Almost." I depressed the plunger slowly. The medication needs time to disperse into the muscle tissue. Rushing it causes pressure, and pressure causes aching. I counted to 10 in my head, withdrew the needle at the same angle I'd entered, applied gentle pressure with a clean swab. "Done," I said. He turned to look at me, and there was this expression on his face. I've seen it before, but it never gets old. It's the expression of someone who built something up so large in their mind that reality couldn't possibly match it. And then reality just didn't bother trying to be scary. "That was nothing," he said. "That was something," I corrected him gently. "You just handled it well." He laughed. It was a real laugh, the kind that comes from relief, from the sudden release of tension you didn't realize you were holding in your chest. He rubbed the back of his neck and said, "I feel like an idiot." "You're not an idiot. Needle anxiety is one of the most common fears in adults. There's a whole name for it: trypanophobia. Studies suggest somewhere around 1 in 4 adults experience significant anxiety around needles. You're in very good company." He looked at me sideways. "You're telling me facts to make me feel better. Is it working?" A pause. "A little bit." I started packing up my kit. He watched me, still sitting like he wasn't quite sure the appointment was over. I mentioned, because it's worth knowing, that after an intramuscular injection, some soreness at the site is completely normal for a day or two. Light movement helps. A warm compress can ease any local discomfort. What you want to watch for is anything beyond that: significant swelling, warmth spreading outward, fever developing within the first 24 hours. Those would be reasons to call someone. Not reasons to panic, reasons to pay attention. "Fever," he repeated. "How high is too high?" In an adult, anything above 103 Fahrenheit warrants a call to your doctor. 101, 102, monitor it, stay hydrated, rest. But if it climbs fast or doesn't respond to over-the-counter medication within a few hours, don't wait it out. He nodded, committing it to memory. I liked that about him. He listened. Some people hear medical information and let it slide right off. He was the kind who filed it away. I zipped my bag. He walked me to the door, which he didn't have to do, but he did it anyway. And I think it was partly manners and partly that he wasn't quite ready for the evening to be over. There's something about shared vulnerability, even something as small as a needle, that makes people want to linger at the edges of it. He opened the door. The rain had finally arrived. I could smell it, that particular city rain smell, concrete and something green underneath. "Thank you," he said. He meant it. I smiled, pulled my jacket closer. "Take care of that thigh." He smiled back. "I'll do my best." And I walked out into the rain, and I thought, not for the first time, that the moments people are most afraid are sometimes the moments they're most themselves. All that careful armor set aside, just for a second. Just long enough to let someone help. There's something worth protecting in that.